Welcome back to Open Line, talking about the final 2 weeks of open enrollment for the Affordable Care Act. It is still in effect, and you can still sign up just for the next 2 weeks. We have two navigators with us who can help us walk through any question you may have. We're also streaming this live on our Facebook page. A lot of questions coming from Facebook. Also, we're going to take some calls here in a moment. There was a question on Facebook here from Pam Spencer Gibson. She asks, what is OSCAR? And do you have a lot of doctors and hospital choices? All right, so I don't know what that means at all, but can you walk us through what that question means?
So OSCAR is a newer health insurance company to Tennessee. So it is one of the carriers that is offering plans on the marketplace only in the Nashville area, which includes Murfreesboro, Clarksville, kind of the Middle Tennessee area. They have a variety of plans available on the marketplace. They do have hospitals and doctors in their network. Yeah.
So it's a plan. It's like Blue Cross Blue Shield, right?
Yes.
Just called OSCAR.
OSCAR.
Yes.
And they're really well known, like in Cleveland, like Cleveland Clinic. They have a lot of OSCAR plans. They're very well connected with Cleveland Clinic, which is a very renowned hospital. So when you look at somebody that's kind of connected with the Cleveland Clinic, I tend to think they probably going to be okay. And they're very techy. We found that they are, one of their sponsors I think is like Google, and so they have a lot of apps with their plan where you can like snapshot your spider bite and then send it over to your concierge team, and they all consult, because you get a concierge team with OSCAR. So you have 4 people that's on your concierge team.
Wow.
And they'll look at that, consult, and they can, from that snapshot on that app, call in a prescription or say, well, I think this is going on with that, or maybe you need to come in. So I think millennials probably would be
they would like OSCAR.
They would like OSCAR probably because it's kind of techy.
And some of the other people would not like OSCAR.
Well, yeah, for that reason.
All right, let's go to Tony. Hello, Tony.
Hey, thank you for taking the call.
Sure, go ahead.
I've got a couple of serious issues, which is insurance you're talking about. First of all, I'm a veteran, and I've gotten hundreds of calls, hundreds of flashes and emails every day. Even though I'm a veteran, I go to the VA to take care of all my care. But this new sign of people, they can't comprehend that, and they are harassing and stalking you, even though you have a plan, because I can't get that long as I'm taken care of by the federal government to the VA. And the next thing I want to know is, as soon as they started selling this healthcare insurance, all these life insurance companies have stole all this stuff off the websites and have flooded the neighborhoods, confusing seniors like myself and others, trying to sell you life insurance when you're trying to get health insurance. And that's what's taking the big chunk out of everything. These companies ought to be fined and ought to be put out of business. And this is bad. Every day it's like you're on a death panel. They're trying to send you some life insurance instead of health insurance. Something is really wrong with this country.
All right, Tony, thanks for both those. What about what he's saying there?
Wow, and I agree with him. I hear a lot of people that come in with that same complaint that they're just getting inundated with information and material and requests to call them back and try to sell them a plan. I don't know what agency you could probably make the complaint with. It could be TDCI, Tennessee Department of Commerce and Insurance. Maybe you could call and make a complaint about it and see what you can do about it, or some kind of consumer group in Nashville where you're calling to say, I'm getting harassed by all the unwanted calls. But that is a concern that a lot of people have when open enrollment opened, and then you have Medicare enrollment open at the same time. A lot of people are getting that same thing, and he's right. He's a veteran. Usually they have TRICARE, so they don't even have to deal with any of this ACA or, you know, open enrollment for Medicare. I hate to hear that
people's information is out there and then they're being solicited, you know, and harassed or bothered.
And so I actually had some people call me the other day and ask, You know, we've been getting a lot of phone calls, and does this have anything to do with when we met with you the other day? And it doesn't. The healthcare.gov does have to keep your information private, and there's a privacy statement at the beginning of the application. So when you have insurance companies calling you or life insurance companies calling you, that is not affiliated with the ACA at all. But as he said, it is an issue, and there are a lot of people who are getting a lot of calls from companies.
Barry Allen here on Facebook says, all my doctors are at St. Thomas, and I've had insurance through ACA for 4 years, and I have not had one problem. I also had a surgery this year at Summit Medical in Hermitage. No problem there.
Yay.
So there's somebody.
There's several stories like that, and I wish, thank you so much. Is it Barry? Thank you so
Barry
much
Allen.
for sharing that. And that's what we need, is people that are experiencing the Affordable Care Act and it is working for them. We want to hear those stories because it dispels so many of the myths and misinformation that's out there.
Let's go to Sheila. Hello, Sheila.
Hello?
Yes, go right ahead. What's on your mind?
Yes. My question is, if one is in between jobs and you're not covered through the employer, you have to be there for so many days before you can get insurance. How do you should you just continue with, like currently I have Blue Care, will I just automatically sign up for that?
All right, do you understand this question? All right, explain this question.
So Blue Care is actually one of the carriers for TennCare. So it sounds like that Sheila has TennCare right now, which is great because even if you do accept your employer insurance, you can still have TennCare at the same time, but you would need to report any changes of income to TennCare when you have a TennCare plan, and if your job is changing. So that's something that's important for her to know.
Okay. All right. Does that answer your question? Does that answer your question, Sheila?
Thank you.
All right. Thanks. Let's go to Lucy. Hello, Lucy.
Hey, y'all.
Hi. What's on your mind?
I've got some information, okay? If I can read these notes, it's not my handwriting. Okay, you know, most people have a very small amount of insurance on their auto policy, okay? And the way that people are tailgating in Nashville now, I think I would not count on that auto policy. So, say you have maybe a $20,000 limit on your medical on your auto policy. Here's the notes that I've got. 62 years old, $28,000 income, Davidson County, the price for Oscar with a $7,300 maximum out-of-pocket deductible everything, and it can go up to millions, and after $7,300 you pay nothing, okay? It's $775, but wait, after the tax credit, $3.99 is the monthly premium. And right here, okay, St. Thomas Health, Ascension, the Children's Hospital at TriStar Centennial, and TriStar Health is what it's saying where you can get medical care. So I don't think you have to go under the bridge to see the doctor with these plans, and I think there is a lot of misinformation going on out there. And if I was, that's for a 62-year-old, I'm sure it's a lot cheaper if you're like 30, okay? Because it goes down quite a bit, and it is income-based, but you would be ignorant to not pay $50, $25 a month, or just $0 a month, and have something catastrophic come up and it ruins your credit, you know, or your car insurance doesn't pay all your medical bills. That's all I'm saying. To me, that's what insurance is for, is not to really use it, but to be there so it doesn't mess your life up. So that's all I wanted to say.
All right, Lucy, thank you for that.
We can end the show with that. I mean, I'm telling you, that is exactly what we try to get out there. She said that better than I could ever say that. And for her to be a person that is not a navigator, you know, has nothing to do with the ACA, a consumer, or just a person that looked it up herself and found out that information. Everybody can do just that. You can go on and find out the information just like she did. And it is amazing that there's so much misinformation out there, because what she said is so spot on. I'm so glad she called.
Because it's become political, and people have taken sides, and they throw out information. It sounds like somebody could throw out information. Well, this policy is going to cost $700 and something a month. When you hear that, it's like, forget it.
Yeah.
This is worthless. I don't want any part of it.
Right.
But then she said, with the tax credit, it's $3.
Right. That's exactly right.
And so it's factual to say the premium is $700 a month.
It's factual to say that.
But it's only part of the information.
That's only part of the information, and that I'm so glad she called.
Well, way to go, Lucy.
Yay, Lucy.
We're glad you called. All right, we're going to take a break. Then I want to hear, if you all can think of some of the stories you're hearing from people who call in, you know, how they're benefiting or not or whatever. Just some stories from people who call in. We'll take a break, and if you want to call, there's our number, or on Facebook. Be back right after this.